A lot of people have been wondering, are we going to see a sharp increase in the amount of COVID-19 cases we have here? And what are doctors on the front lines preparing for?
And we're getting more information on what wearing a mask can do to keep numbers down. Dr. Michael Daignault from Providence St. Joseph Medical Center joining us now to explain. We're happy to have you once again. Now, a physician from Arizona said it's unmistakable that the surge in cases they're seeing in Arizona is due to their reopening on May 15th, and there is concern that they're maxing out their ICU beds in many hospitals there. What is the situation here in Southern California?
Well, I think the key statistic that we have to keep in mind is not so much are the numbers of positive cases going up, but the first one is the percentage positives, like how many tests that we're doing, is it because we're just expanding the testing or is it because we're seeing a surge? So the number here is around 4.5%. That's the positive percentage that comes back on those tests. And that's been relatively flat. And the second thing I keep track of and that we really need to pay attention to is the rate of hospitalizations and the rate of admissions, because that tells us that we could potentially be seeing a surge. And again, that's differing from county to county between Ventura, LA, and Orange County. And so we really need to keep track of that because that tells us that we're getting a lot more sick patients coming to the hospital. And when we talk about flattening the curve, that's always what we were talking about, is making sure that the rate of hospitalizations and the ICU admissions, stays flat as we continue to progress through this reopening stage.
I also want to ask you about that new research that we've been hearing about this week with that common and very inexpensive steroid drug that they're seeing could help reduce the amount of deaths of COVID-19. What do you think about the use of this drug?
I think this, we just have the preliminary results from this massive trial in the UK on dexamethasone, Decadron, which is a steroid that's been around for a while. And to me, this if the preliminary results hold up the independent analysis, this could be a total game changer. I mean, for patients that are admitted to the hospital that are either intubated, requiring mechanical ventilation, or require oxygen, this has been shown to reduce their 30-day mortality by 30% in some cases. And this, like you said, it's a low-cost drug. It's relatively widely available, very little side effects. And if we have this, and then we have remdesivir, which reduces, your ICU stay from 15 to 11 days. I mean, this is the best news that we've had in months. And, I'm really hopeful that this will help a lot of people.
Dr. Daignault, real quickly, what does that steroid do? Does it reduce inflammation? Specifically, what does it do?
Good question. So, as we're seeing this with COVID-19, it's a multisystemic inflammatory disease. And so steroids work specifically by reducing the inflammation in your body. So you hit it right on.
Okay.
Oh, Dr. Daignault, thank you for your time. We love to get the positive results from you as well as always. And hopefully everything you said does come to pass down the road. We need some of that right now. Take care of yourself.
Yes.
Happy to hear that. All right. Have a good day.